Today's episode has been brought to you by Schedulicity.
And also by the Pelvic Health Professionals membership site. If you are interested in becoming a member, you can join until January 17th, 2020. Visit pelvichealthprofessionals.com for more information. Who is this membership site for? It's for anyone who wants to use pelvic health information to empower the people that they work with who have a pelvis. In the group, we have yoga teachers, physical therapists, midwives, doulas, massage therapists. It is an amazing group. We have monthly guest expert calls, and this is actually how I met Dr. Susie Gronski. She came and spoke with our Pelvic Health Professionals group, and that video is in our resource library. We also have a supportive online group, a growing library of up-to-date videos and resources, including an 8-hour online yoga for pelvic health training, which all on its own is $379, but as part of the membership is $25 a month or $250 for the year. And that price will likely go up the next time the doors open. So make sure that if you're interested, you get in there now. On top of all of this, we also have monthly Q&A calls. This is where we get together as a collective group of professional peers, and we ask our questions about business, running a business, teaching pelvic health, all of our pelvic health questions. It is an amazing group of people. I had this vision of creating this membership because I wanted all professionals, yoga teachers to PTs to doctors and doulas. I wanted them all to be able to learn about pelvic health, serve the people they work with, and also collaborate and work together and teach other people what they know about pelvic health from their profession. If you are interested in learning more about the behind the scenes of the membership and how this works and all of the kind of numbers and what it's like to run a membership site, back in episode 150, Amanda McKinney and I talk about it because we both started a membership site in 2019. Okay, let's dive into today's episode. Hello and welcome to the Connected Yoga Teacher Podcast. I'm your host, Shannon Crow. I'm a mom of 3, I'm a yoga teacher, and I'm also a trainer and consultant who works for yoga teachers. And this podcast was created for you so that you can connect to information and inspiration every single week. Because I know you're busy, you can't always take a weekend or 2 weeks or a month to learn. I would like to condense some information, have it so that you can learn on the go. It's also really important to me that you feel supported as a yoga teacher because you're navigating not only being a yoga teacher, but also being an entrepreneur. If you've listened to this podcast at all, you know that I love talking about pelvic health. It's really my niche, my specialty as a yoga teacher, and I bring that to the podcast, and we've had amazing response. So here is another episode today on pelvic health. And we've talked about pelvic health in other episodes, but mostly they've been about female-bodied people. The links for those shows, if you're interested, will be in our show notes. So that will be at theconnectedyogateacher.com/151. This week, though, we're diving into male pelvic health with Dr. Susie Gronski. There is some amazing content in this episode. If you know a male-bodied person, or if you are a male-bodied person, I would for sure pass this along to any male in my life. And as I said, Dr. Susie was also a guest in our Pelvic Health Professionals membership, and there she shared more about this topic and more resources. So if you're interested in that, go to pelvichealthprofessionals.com. In this interview, Dr. Susie shares with us how yoga can be beneficial to male pelvic health in particular, and some of the concerns that male-bodied people have regarding their pelvic health. So what's really cool is Dr. Susie is not only a physical therapist, a doctor of physical therapy, but she's also a yoga teacher. We talk about a variety of topics from pelvic pain, urinary issues, how pelvic health relates to sexual function, and myths around pelvic health. It's really great content that I can't wait for you to hear. All of our show notes are ready for you at theconnectedyogateacher.com/151. And there you can find some extra links to our previous pelvic health topics, as well as some links to Susie's resources. A huge shout out of thanks to Lisa Martin. Lisa sent me a note after the pelvic health training. I got to meet Lisa in person, and I am so excited that she is taking pelvic health into her community. Here's what she said. I just wanted to thank you so much for the course this weekend. The information was beyond my expectations. It was such a great experience, and I cannot wait to bring the information into practice. I can really see how I can use the Pelvic Health Professionals membership to all of its potential. I was feeling lost in the business of yoga. Your podcasts, teachings, and posts have helped me so much. Thank you, Lisa. That means so much that this is helping. I know what it feels like to feel overwhelmed as a yoga teacher, and I was thinking before I created the podcast, what would I like? I love listening to podcasts. I would love it if information could come to me every single week and I could learn as I was driving or walking or gardening or cleaning. Gosh, podcasts really make cleaning go so much faster. I also want to give a shout out to our sponsor, Schedulicity. Schedulicity makes sure that this episode gets to you each and every week. And they also provide a really cool hot tip, so let's hear from them.
Hey there, connected yoga teachers. This is Blake with the Schedulicity Hot Tip of the Week. If you don't have a website, your Schedulicity account includes a business listing page where you can show off your services, classes, workshops, and business information. You can choose when you're ready to make your business listing public, so it will stay hidden while you're still getting set up. You can control whether or not your clients are allowed to book their appointments online, and you'll appear in Schedulicity's search results when your listing is public. If you already have your own website, you can copy and paste the code for our booking widget and allow your clients to book online without navigating away from your page. Having a strong internet presence helps take your business to the next level.
Thank you so much, Team Schedulicity. Okay, let's dive in, connected yoga teachers. Dr. Susie Gronski describes herself as the physical therapist for your privates. She's a licensed doctor of physical therapy from Midwestern University, a board-certified pelvic rehabilitation practitioner, and a certified health coach. And on top of all of this, she also is a yoga teacher. She spends one-on-one hands-on time with her patients, teaching them how to be the expert in treating their pelvic pain. She also hosts the In Your Pants podcast. She has honest, open, and transparent conversations about debunking myths around pain, pelvic health, and sexuality on that podcast. I would highly recommend that you check it out. Let's dive in and meet Dr. Susie and start learning about male pelvic health. Welcome to the Connected Yoga Teacher Podcast, Susie. It's great to have you here today.
Thank you so much, Shannon. I'm excited to be here.
Tell our listeners that maybe don't know your work, what is the work that you do and who do you do it for?
So I'm a doctor of physical therapy or a physiotherapist known elsewhere, and I work with private parts. Particularly, I found myself working with male-bodied people. So that is who I market to and who I cater to, although I do see female-bodied people as well. I just, in my career, several years of doing this, I realized that there was a lack of a voice and a space for male-bodied people to get care for their private parts. And once I realized this, it just flowed in that direction. So
Right. So has it been difficult having female body parts and addressing male body part issues in the pelvic health world? I'm sure you weren't thinking when you were like 8 or 9, when I grow up, I'm going to be a pelvic health PT who specializes in male.
I'm going to work with dangly bits. Yeah, right. I want to work with penises all day, right? No, actually, no pun intended. There is no I wish there was more of an exciting story behind it, but it literally was, I opened my practice. I really kind of welcomed all people. I didn't really know where I wanted to take, pelvic health because, you're right. A lot of it is women's health and catered around, mom and baby or postpartum or some genre of that. And I had men seeking help for issues, and they started to just pop up at my door. And I started to ask questions like, how can I reach you guys sooner? What would help you? And all across the board, it was like I had nowhere to turn to. I didn't even know this existed. I didn't know physical therapy was a thing for me or that could help me. And by the time they would seek out help it would be several years later, and I thought that was a huge disservice. And I was like, no. And I can't tell you why or how I'm super comfortable with working with male bodies. I always joke that I was probably a man in another life at some point or something. But I have never had like reservations. Of course, it's, when you're getting into this field, I think anyone who's working with the opposite gender can have their own reservations, and that's completely normal. And of course, I did have feelings that arose, were like, oh, can I go here? Can I do this? But as I kind of started to listen to these men, I realized that they really just they really need reassurance, and they want someone that they can feel vulnerable with, to have a safe space to open up about these very intimate topics. When they go see a urologist, when they see other healthcare professionals, and I'm not stereotyping any of them, I'm just saying that this is a common theme that I've heard, that they're not even looking at their parts. They're not saying like, let's address the issue. Let's look at it to make sure things are okay. And here's what we can do about it. So reassurance and education is a huge component of what I do, and allowing the person to feel really comfortable in their body and in the space that we create. Because as we know, context is everything, and creating the trust between a practitioner and the person who's seeking your help is really important. So
that's good. I'm so glad that you are doing this work. It was through the interview that I did with you for our pelvic health professionals membership that I started to realize, oh, wow, I thought, women didn't really have that much of a focus on their pelvic health. And then after talking with you, I realized, oh my gosh, if women don't, men have even less. It's pretty amazing.
It is. It really is. And again, they're just really, it's a barrier. It's a social barrier. It's a psychological barrier when we start talking about health-seeking behavior in general for men. I think there are some stats out there universally or internationally that say men typically don't even seek health care in the way that women would, or gather in community. And there's a lot of isolation, and there's stigmatization and taboo around helping, male bodies. I'm just one of them that tries to say, no, like, you don't have to suffer. There's something that we can do to help you, and know that there's help. So
that's great. My vision for today's episode is that we kind of outline some of the things that men might experience in terms of pelvic health dysfunction, and then look at both, because you're a yoga teacher and a PT, I'm so excited that we get to look at both sides of like how you work to help these people, and how also our yoga teacher listeners can bring some of this into their class, or think, oh, I'm actually helping the men in my class in different ways, even if we're not focusing on male pelvic health. So what are some of the main things that you see with men when they're coming in to talk to you about? Yeah. So some of the main, and I just want to say that it makes me really uncomfortable to say pelvic health dysfunction or pelvic floor dysfunction. It sounds pretty harsh.
I agree. I actually have a blog post on that using the term dysfunction, because there's a lot of stigma around erectile dysfunction, this, dysfunction that. We're such a nocivic culture. Like, I feel like it's always negative language. And there's a lot of research to state that, like, the more negative expectation one has around whatever issue you're going through, the less optimistic the outcomes will be for future or new approaches tried for what you're seeking help for. So I'm a huge proponent of being careful with the words that we choose with people, particularly around their bodies and their ability to do things in life. I think we should really start to frame or reclaim self-efficacy, autonomy, independence, and empowering the person in front of us, instead of looking at all the negatives. Like, this is what's wrong with you. You've got this. And then, I can talk for hours about labels and diagnoses. I won't bore you with that.
So maybe what we'll call here is like, what are some of the things that you are seeing that men come and say, like, Susie, Dr. Susie, is this, they call you Dr. Susie G on your podcast. What about this thing that I'm experiencing? Is this normal?
Yeah. So some of the common things that I'll hear guys talk about or having issues with is sexual dysfunction being one of them. Of course, dysfunction used lightly, but they have sexual concerns, and basically they're just not sure if that's normal or not normal. And a lot of my role is to educate them. So some things about erectile function, how their penis works, premature ejaculation is another term, or early ejaculation. You'll have, Peyronie's disease. Again, I hold lightly to disease, but that's where, there's a connective tissue issue happening in the fascia of the penis, and that can lead to a curvature that might be problematic. Again, curvature might not be pathology. We really don't know how or why something like that arises for a guy, but there is help for that. Then you have pain. Pain anywhere in the genitals and the abdomen, with sitting, typically lasting greater than 3 to 6 months. There is usually no known pathology or cause. If looking for tests or scans or something like that, it usually shows up negative.
So when you're saying pain, do you mean painful intercourse or just pain in general?
It could be pain in general. It can be associated with sexual function. So having an erection after ejaculation. In any of those, some men will complain of burning or stinging pain in the penis or the tip of the penis, pain with sitting, a golf ball feeling, or pressure in the rectum. This may or may not be associated with urinary issues as well. So urgency and frequency, even post-void dribbling or some incontinence. Then we're talking about the backside of constipation, digestive issues, difficulty having a bowel movement, maybe painful bowel movements. So this is a broad, when we talk about pelvic pain syndromes, this is a very broad umbrella. There's a lot of symptoms that one may experience given the complexity of this area.
Yeah. And also, I'm guessing prostatitis is included in that.
Prostatitis, yes. However, hold lightly to that term because it is a label, one of the diagnoses used to describe chronic pelvic pain syndrome. I mean, if you're looking for it, that's the term CPPS, which is one category of prostatitis, and I say this in air quotes. Really, the prostate has been blamed for a lot of male pain issues, but if you look at the research and the literature, the stats are about 95 to 97% of them have no correlation to an infection at all. Which means less than 5% is actually due to an infection. And even in those cases, you have even a category, which I think is interesting, asymptomatic inflammatory prostatitis, which means there are no symptoms, but you have inflammatory markers present when you do an analysis, a scan or a diagnostic test for prostatic fluid or seminal fluid. So
just to clarify, does that mean that the prostate isn't even enlarged at all for that asymptomatic one?
Yeah. So benign prostatic hypertrophy, or BPH, is a common occurrence in men as they age. The prostate does enlarge. Everyone is different. And you also have men who have, quote, enlarged prostates, but don't have any symptoms either. So prostatitis isn't BPH. BPH isn't prostatitis. They may be correlated together sometimes for an individual, but they're not causative.
Okay. And you're right. Like, I feel like if men complain about anything pelvic health, it's usually like someone's like, have you had your prostate checked yet?
Right.
So you're saying we can't just say that's what it is. And even that, we're not sure.
Exactly.
It's pretty low that it's actually prostatitis, meaning there's an inflammation and bacteria present.
Infection, correct. Yeah. And there's a lot of unknown bacteria and pathogens that scientists even haven't discovered. Like there's a case I'm collaborating with a functional medicine provider here in town who, this gentleman, persistent pelvic pain for several years, very debilitating psychologically in his life. I mean, it's a big deal. Reach out to me for a consultation. And I suspected there were some, just based on his history, some immune mediated triggers from a biochemistry standpoint, because we know that pain is just not in the tissues. It's a collection of processes of the entire person, their world, what's happening internally, externally. So, but anyway, so I suspected that there was some immune-mediated function. Of course, he's gone through so many tests, invasive tests, checking his bladder, his prostate. It's never fun to go through that and having so many doctor's appointments and then them telling you like they can't find anything or they can't help you, which is like a death sentence, in my opinion. Like, what am I supposed to do now? But I digress. So I said, let's kind of look at your gut health. Let's look at, what's happening at a more microscopic level, and let's work with someone who can actually take a wide lens approach. And it turned out there was an underlying potentially, harmful bacteria in the prostate. And so he was treated with herbal antibiotics and had a protocol of eating well and let's stop drinking and all that. There was a lot of other things happening, and he got better. He was like 98% better after 2 months. But interesting, this is why I bring up the story, because when they did a reassessment of the test to check if the infection was still present, it was. But he was feeling better.
Oh, wow.
So I just bring that up as like case in point of it's not always, the bacteria or potentially harmful bacteria that's showing up on a scan. It's just a snapshot in a moment of time that is constantly changing. And, if you give someone a plan, like let's talk about a placebo here, you tell them, oh, we know exactly what's causing it and what's happening. And so now you've planted the seed of like, I can help you. We know what we need to do. Here's a plan. Right. And so he has something to do. He's, working with wellness providers that understand him and validate him and are helping him move forward and supporting him. He's doing better despite the fact that that infection is still there. So it's just fascinating. We never think about it, right? Like pain and all that. We just don't think about it in those ways. So
that's really empowering, because then people can be making that shift, especially like you said. And there are many cases where people go to their healthcare providers and then they're told like, we're not really sure where this is coming from. Like nothing's showing up, or the worst thing, like it's all in your head.
Right. And I think often when we're talking about the nervous system and the brain, I do that a lot because, pain is an emergent process. It's not linear. It's not X plus Y equals Z. You have many instances where you have tissue damage and harm in your body, but you don't experience pain. I mean, I had one of them. I had, a huge cut in my leg and my whole calf muscle was exposed. I had no idea that even happened or how long I was bleeding out until somebody pointed out to me. I mean, and I've never thought twice about that situation until my career now, where I'm like, wow, I never really thought about that, pain isn't just what's happening in your tissues or in your body per se. It's not coming from your body. It's essentially an experience, a conscious experience that's very personal for you. It doesn't mean that it doesn't exist because it's very real. It just means that there's a collection of processes, both electrophysiologically, molecular, but also your experiences, your memories, the context of which this whole situation arose for you, your learned experience of pain, observational learning. There's so much that goes into one's meaning of pain in their life and their experience. And when we're talking about men, again, unfortunately, there's a social cultural stigma about how men should act, how they should react, how should they behave. Health-seeking behavior is different, So, I think all that comes into play when we're talking about, one's self, one's social self in the construct of pain. So.
That's fascinating. I also want to bring in the relationship of low back pain, because oftentimes we're thinking, okay, this has to do with the pelvis, but do you want to touch on if men are experiencing low back pain and how that's related to pelvic health?
Yeah, so it is correlated. Low back pain and pelvic pain may be correlated. There is a higher correlation. We can't say it's causative, but it makes sense biologically because the nerves that exit from your back go down into the groin, and some of those nerves actually supply sensory information to the testicle. So they pick up on sensory information. They innervate the testicle. So you'll have, like, for example, L1, L2 from the lumbar spine that goes down into the testicle. And so often when we are working with guys who have testicular pain, for example, we want to make sure we're ruling out any mechanical triggers that might be influencing, maybe cranky nerves that are getting entrapped somewhere along that trajectory or that pathway. But we also know, again, there's a lot of crosstalks from the sacral nerves. So the nerves coming up and innervating the posterior, the behind the scrotum. And, again, there's a lot of crosstalk. So we can't just, again, pick out one nerve or blame pudendal nerve, which is common as well. Like, pudendal nerve is S2, 3, and 4, keeps your poop and pee off the floor. Those nerves innervate the pelvic bowl or the pelvic muscles in that area. But it's not just that. There's so much crossover between muscles, joints, ligaments, bones, but also the viscera. So your bladder, the prostate, and the rectum that are also being influenced because you have afferent, or you have fibers, visceral fibers that are part of the pudendal nerve as well. So it's sensory, motor, and visceral in origin. So there's, again, a lot of crosstalk. So it's complicated in the pelvis. But yes, low back and pelvis, low back. It's like nosy neighbors. If you have one area that's, heightened sensitivity and the alarm bells are going off, well, then the neighboring neurons in that area are also going to kind of perk up. So, and vice versa. Again, we just can't say what came first, the chicken or the egg, or if there's a causation. There's a correlation, but not necessarily causation. And it is common in my practice to see men who have testicular pain or pain in the perineum or anywhere in the perineum or the pelvis to have complaints of, some low back discomfort.
Okay.
Mm-hmm.
And also, I also want to touch on the pelvic floor because I feel like women get a lot of spotlight in this area. So women are told, strengthen your pelvic floor or release your pelvic floor, all kinds of cues and things.
Yeah.
Men, probably not as much. Is there any research to say, how is the overall male pelvic floor doing?
How is it doing? Oh, so in terms of function, you mean like how it functions compared to female? Okay. So the parts they're organized differently, but they act in the same way. Now, there are research articles done by Paul Hodges that state that cueing for engaging pelvic muscles is different for men than for women. So plus men have a longer urethra and the muscles that, again, they're organized just differently, but they're functioning in the same way. They contract, they release, they squeeze, they release, and then they also lengthen actively during, bearing down, like having to have a bowel movement, for example. So yes, and they aid in the pelvic muscles for male-bodied people also help in erections and maintaining an erection and sustaining an erection. So there's coordination and control for that. And that's also involved with issues like premature ejaculation. Again, it's more of awareness of this part of the body versus like a strength issue per se. Because I think that the same messages are sent for men, like do your Kegels, but it's not just about the contraction, but it's about the coordination and being able to adapt to different loads and situations that the pelvis undergoes, like coughing, sneezing, jumping, athleticism, whatever. It's always involved. It's not like you can turn them off. But in some cases, like post-prostatectomy, so after having prostate cancer treatment, which may result in surgery, we definitely want to make sure that the person understands even before they have surgery, because there's muscle memory of understanding how this part of their body works, that they do have muscles that control urinary function, because after surgery, there is a loss of the internal mechanism of continence control. So there's an internal sphincter and an external urethral sphincter, and the internal one is the one that's no longer available after surgery. And so now you're working with the one that is the external, which is under your voluntary control, which is great because we can use that to our advantage in terms of rehab afterwards. But yeah, shortening the base of the penis are cues, holding back pee. I like to use flicking your penis up and down. Most guys know what that means. I don't have a penis last I checked, but I when I say that, they like laugh and they're like, yeah, I totally get it. And so it's how do you connect the cues for that particular person? and making sure they're getting it and providing feedback. I love using mirrors, like long-standing, long-length mirrors to help them connect visually with seeing their parts move and maybe some compensations they're using. So again, I'm just there to coach them, not necessarily body shame them or tell them what they're doing wrong, but just bringing more of an awareness and something that they can optimize for better function and control. So that's urinary function.
That's good. I heard you say one time that it's like men and women are built very similarly, but that the organs are on the outside for men and on the inside for women.
Yeah, well, like for women, the clitoris is a lot of the clitoris and the organ, the sexual organ, the erectile tissue for a woman is like internal a little bit. You just see like the little clitoris and the clitoral hood, but a majority of it is underneath tissue. And for men, it's just more external. So, but they're just homologs to one another.
Right. And so what about the relationship between, I've read some studies about when we see stressful images and how the pelvic floor reacts and how that can sometimes translate into other pelvic floor dysfunction. Do you want to talk about that with regards to men?
Yeah. So the study that you're talking about was done for women that had, there was a control of women that didn't have pelvic pain and those that did. And they showed them images from a movie. I think some of them were like Jaws and some other threatening, scenes, and also sexually related threatening scenes. And they hooked them up to like a sensor that measured their muscle activity. And they saw that the images that were more threatening, both groups like their pelvic muscles responded in this like protective guarding, like there was tension and there was like, whether or not they knew about it. So it was interesting. So we know that there's a protective guarding or mechanism in terms of safety, right? Like what contracts and obviously the genitals are a vulnerable area and a very intimate area. So it does make sense that would be an area that like tenses up when something is like threatening. And with pain, that especially in the genitals, well, guess what? You are going to be tensing and tightening because it's a protective response. It's a motor output that's, again, more of a protective response. Something hurts. And I'm sure you can relate this to any part of your body that hurts. You're not necessarily super like fluid or let your body, you change the way you move. The muscle tone changes, how you behave, how you react. So those are all protective responses. I'm not aware of any study that was done on men, like doing that. But I can imagine that it's the same because they'll tell you, the men that I work with will tell me that, just thinking about, someone touching their testicle or in terms of like having testicular pain, a lot of them will like wince or make other behavioral do it something other behaviorally to let me know that it's uncomfortable for them. They'll cross their legs during intercourse. If they talk about like, if the testicle hits something or is like, rocking or stretching or being free, like they'll kind of like do one of like a beaver face or something and be like, no, I don't want to, So I know they're like tensing because I can see it in the rest of their body and I can only assume that that's being reflected in their pelvis. And so part of my role is to help them to be aware of like that protective response and question whether or not that's necessary for them and give in that moment, like, do we need to continue to protect and guard? Is there opportunities in your day where you can soften and release? I don't like to use the word relax a lot because they've been told, and I'm sure this is the same for women, like relax, just relax, let it go, just relax. That's what, and it's interesting because, how do you measure relaxation for someone? How do you measure tension for someone? I mean, we know there's physiological changes that happen and we can sense there's a change in tissue, but to objectify or to tell someone when you're evaluating them, like, oh, you're super tight. I just had a gentleman yesterday say he's heard that he's been told by a therapist that he's the worst she's ever seen.
Oh no.
I know. And that's, and that's where I draw the line, because now I'm here doing damage control and saying, like, questioning, or at least having the person contemplate whether or not that's a valid statement for them, because he was feeling terrible. He was feeling like, at the worst, he was feeling at his worst, just had surgery, all these things. And then you have a finger going in the bum that you really, it's uncomfortable. So what is the natural response for that person on the table going to be, if not tension and tightness? So how are you, as the, assessor, how are you going to convince me that that's an actual measurement of tension or tightness or the worst that you've ever seen? I mean, I just think that's silly. So
yeah. I'm so glad that he came to see you after that then. For our listeners,
we're working on it.
for our listeners, in the previous interview with Susie, and I don't want to get all into this, I know that she spends a lot of time on the education piece and really empowering the people that she works with in terms of, because it is uncomfortable and it's a sensitive area. So I want to get into next, what are the benefits then to go see your pelvic health PT or to go to yoga class for some of these issues? Like, how do you see this helping people?
So it doesn't matter kind of what they've been diagnosed with or labeled with, just understand that that person might be having their own discomforts in their body. Particularly, I'm talking for yoga, like, right, yoga teachers, they're not going to get into the nitty gritty of someone's health history, but know that some of the gentlemen that walk in your door might be experiencing groin pain or having some sort of, sexual health issue. Mindfulness and slowing down and allowing the nervous system to adapt, in that moment is awesome. I mean, a lot of the things I do is incorporating yogic philosophy of connecting movement with breath to gain a greater sense of body awareness, because that's where it all starts, is having that person start to gain an inner experience of, well, how is my body doing? How is my mind doing? Sexual health issues, they often are intertwined with psychological or psychogenic components as well. I mean, if it happened once, it's like once bitten, twice shy, you're worried about the next time and the next time. Are things going to work? And so there is a lot of worry around one's private parts. And I think yoga has an opportunity to bring in that awareness, like in their body. And some of the cues and some of the postures, like happy baby pose and child's pose, a deep, I think it's called Balasana, the deep yogics, the I call it astagrass. That is a wonderful, just very, you're opening the hips, but you're also allowing the pelvis, like you're mobilizing tissues around the pelvis and creating space, blood flow, and movement when we're doing yoga. All tissues want blood flow, movement, and space. So I love it. I really do. And it also, we're talking about the nervous system. When we're talking about sexual function, it is regulated by a reflex driven by the nervous system and other neurophysiological processes and your brain. But if you can help to balance the autonomic nervous system, which is what you do with yoga, right? That can be very nourishing for that person, because they're not just cerebral, or maybe they're really stressed out, which we know stress response mechanisms tend to put the brakes on what's happening in one's pants. And so again, I think just allowing space for that person to express themselves in their own body, without being judged, and feeling supported in community. I think that's really great. So that's one thing that yoga can do for sure. And I bring that into my practice as well, in a therapeutic way, in a one-on-one way. But I just think, if the opportunity arises, to really help with that. And in addition to, some yoga teachers like to use Mula Bandha.
Yes.
So like you doing those breathing exercises and incorporating the pelvic muscles, but definitely those that incorporate letting go and engaging, and not just engaging. And I don't think that there's a lot of education around that in like the yoga community, unless it's a pelvic health class or, unless it has some sort of connotation that when you're going into it, you know what to expect. But in a general class, no one's really talking about, like, they'll say mula bandha, but I don't think there's a lot of instruction of, like, it's important to also let go and engage and let go. And particularly if someone is experiencing pain, for them, it might be worse to consistently engage and contract without letting go.
Right.
So it just depends, and again, I don't expect yoga teachers to be like, let me assess your, how's your pelvic floor doing today? Any sexual issues? Like, that's just not happening. But just be mindful that it's all about balance. Just like when we do extension and inversion postures, we tend to facilitate then that flexion, right? And curling in. So if you're cueing in pelvic terms, I would also encourage the opposite of letting go and breathing and feeling openness in one's pelvis and then engaging, but letting go, engaging, or squeezing and releasing.
Yeah. This is something that I've heard from different yoga teachers over the years, is that they were taught in their tradition or by whatever the yoga they were doing was really focused on mula bandha and that engagement. And different people have said, like, that has caused me to be constipated, or I felt like I couldn't really birth my baby. Like, the pelvic floor was just holding so much tension.
Yeah.
So Shelley Prosco did an episode with us talking about the difference between mula bandha and Kegels. Was there one? It's a really interesting episode. And then we had MJ Forget come in and talk about pelvic floor and why engaging it all the time is not helpful. So I'll make sure to link to those as well.
Oh yeah. And I think those are all valid points, because it's about balance. Like, you're not walking around squeezing your fist all day or in a bicep curl, right? Why would you do the same thing for the pelvis? And it naturally does its thing. Like, you should not be thinking about your pelvic muscles 24 hours, 7 days a week. Like, it's just unnatural. When you're working to improve, essentially, if there's an issue happening, we certainly want to address it. And there are ways that we can address it holistically, taking the whole person into consideration, their whole body, not just their pelvis.
Right.
But there are things that we can do to optimize function and to lessen that person's suffering. Essentially, we want them to suffer less and to have a better quality of life, whether that's moving better, whether that's participating in sexual activity or with a partner, with themselves. We're just really trying to build confidence and empower them to feel like they can manage whatever it is that's happening for them, despite adversity, and that they can move forward through it and have great coping strategies and support. So
this is good. So our yoga teachers don't really, even if someone came to you and said, I have prostatitis, chronic prostatitis, you don't have to really get into all of you might want to read up on it just for curiosity's sake. But it's like, we're coming back to how can we downregulate the nervous system, basically.
Right.
So much of this.
Exactly, because we know how it influences the immune system, right? If you're in that state of balance with the nervous system, your immune system is also going to relax. Breathing exercises are so helpful. Releasing the tension from one's lower belly too. I know that oftentimes everyone I've worked with, and including myself back in the day, was like, I was told to suck it in and use the transverse abdominis and, engage for core stability. And it's like, no. That's all hogwash. Like, we don't want to constantly be sucking it in. And again, if that gentleman is experiencing lower groin pain, testicular pain, pelvic pain, I would certainly bank on, like, they're probably over recruiting already. They're probably tensing in response to, having physical pain in their body. Let's kind of work with letting go and letting them to feel safe and comfortable to let go and relax or soften their belly. So really, it's not always about engaging, but it's also about the opposite of softening. And I love, again, the yogic philosophy of finding that balance between effort and ease in a posture. So you definitely want to, land the plane with your person, but you want to reorient neuroplasticity, challenge the system, holding postures, because they're difficult, but you're also trying to find ease in one's body in response to maybe a sensation that might be uncomfortable or hard. And that's kind of how I use yoga in my one-on-one sessions. Is sensations change. We need to be aware of how they change in pressure, intensity, stretch, and they're transient in nature. And that's kind of how I bring it into with pain. Like, let's kind of get that experience of things do change. Your pain can change. And it's an experience that they only can, I'm guiding them, but I want them to have that experience. And so part of my role is to find ways to find opportunities to teach them that this is changeable, and that if we're just still in that moment without bracing, right, tensing or doing something to just, oh no, I don't want to feel that, it's normal. We're human, and I do the same. But it's interesting because if you just you acknowledge that it's uncomfortable, but then you ease into that sensation, it oftentimes really lessens. The issue is that we react, and that we're reactive, and that we want to hurry up and get rid of this really uncomfortable situation or this feeling, instead of let's ground ourselves. Let's feel calm, because the opportunity to change something is much greater than if we're just chaotic, in our body, in our mind. It's just like, it's a lot of tension and a lot of rigidity, and that never helps with problem solving.
Right.
So,
so how do we encourage men to come to, say, a pelvic health class, maybe a group class, and they might be looking at it thinking, well, that's probably for all the women in my community, or to go to yoga? Do you have any tips or tricks around that? Just because we know that mostly it's women that are attending yoga classes.
Yeah. I would actually create to be honest, I would create a safe space for men, like to have an all guys class. That's an idea, to say, let's have a broga session, a broga session together, again, to help gather in community. And you can have a specific pelvic health class, but for male-bodied people. Or if you are going to have a pelvic health class, make sure in your marketing materials that they are gender neutral. Because we're not just talking about male-bodied people, but now we're talking about those that don't associate with a gender, or non-binary, transgender. So we want to be all inclusive and be sensitive to the needs of our community. And I think the less we just label things, but all encompassing, and that would be great.
Yeah. I like to tell people you can come to yoga for pelvic health if you have a pelvis.
That's right. Yeah. And men have pelvises, and women have pelvises, and so totally. Yeah, totally. So gender neutral and all encompassing, just welcoming all bodies, I think would be great. That's a good start. And I've seen that in my community, actually, where they've had specific male-bodied or bro yoga classes, specifically for men. But the pelvic health classes, the ones that I've hosted, or the workshops I've hosted, unfortunately, it is a lot of women attending. I don't get many men attending.
Yeah. So then let's say there's a male student who's going to class, he's going to restorative yoga, and he has some issue that he's dealing with on his own, and he's going to yoga. He's listened to this podcast, and yoga isn't getting to it. Like, he's tried the more restorative yoga, everything he can for the nervous system. When are you hoping that men come and see a pelvic health PT?
As soon as possible. Because here's the thing, first time, let me back up. When something is alarming down there, from what I've heard from guys tell me, is that they don't know where to look. Like, they don't even know what doctor to see, right? Because we have gynecologists. I'm speaking from a women's perspective. We have urogynecologists and gynecologists. So that's like a, private part doctor for women, right? But for men, like, they're just like, I don't know who to go. My husband would tell you this over and over again. It's like, I would have no clue who to see first for help, like what practitioner. So I think the first thing is they'll Google a lot of things. And I think a lot of us do anyway, but they'll Google. It's a catch-22 with Google. It's a love-hate relationship, because oftentimes they'll find me through Google, but not before they go through the muck of I think the catastrophizing of what could be and the horrible things that can happen, and there's so many people that are still suffering in the forums and stuff like that. And again, I know that shapes that person's expectations of them being able to get help. So I would be surprised to have people come into my office like 1 or 2 months in. That would be awesome, because you're not, again, the memory traces and the emotional learning that occurs when somebody is in pain is less sticky earlier on. And the more that we can start to lay the foundation, the framework of, let's reassure you, let's tell you what's going on. This is what you can do to help yourself. And I've worked with many people who have similar symptoms like you, and they get better. And so once you kind of plant those seeds, in my heart of hearts, I do believe that the chronicity of those symptoms would probably not last, given that you are reassuring, you're getting it right in the beginning. Unfortunately, that's not happening for a lot of guys. They'll go to their primary care physicians, their urologist, or some other doctor, and they'll be given antibiotics right off the bat without even getting tested for an infection. And then now you're waiting. So you're taking antibiotics for 6 weeks. That disrupts the gut microbiome. You may not even you probably didn't even need it to begin with. All antibiotics have some analgesic effect. You might feel better, but then it comes back.
Right.
And then you're worried. And so then it's like down this rabbit hole. And again, I'm not here it's unfortunate. It's not the physician's fault. It's just a lack of knowledge. It's a lack of, well, what do we do to help these guys that are having symptoms of pelvic pain? And I think the greater message is, let's just try to be all inclusive and all encompassing of the person in front of us. It's really hard to get their story in 8 minutes. And we're not, and it is in the literature and in the research that, doctors aren't asking about sexual health for men or for women. They're not really even educated in sexual education.
Right.
So I just think that we need to start to have these discussions or this education in the curricula, in the school system, in graduate school, and for programs, not just for medical providers, but for all health professionals working with people, being aware that, issues do happen in that area, and we need to start to talk about them and normalize certain things and not over pathologize or over medicalize or over treat when it's not necessary.
Well, this is so good. I want to come back to the point where you said, the brain is sitting in that for a longer period of time.
Yeah. And we know that emotional learning, there comes a point where, maybe there was some aggravation in the tissue or an injury or whatever, right? That is driven by nociceptive processes, which nociceptors are just messengers, nerve endings that are responding to a noxious stimulus or a potentially noxious stimulus if it were to prolong. Again, it's a message. It's not necessarily meaning that person is going to experience pain, but it does kindle the flame, so to speak. And that sends messages to the brain. But anyway, that process, that tissue-based process, we know if things persist for an extended period of time, that things start to shift into an emotional learning category. So It's no longer a nociceptive process or a tissue issue per se, but now we're getting into learned and the learned conditioning, positive and negative reinforcement of pain, observational learning of pain, so forth and so on. So it's just fascinating that, us as healthcare providers, even yoga teachers, not just looking at the biomedical or the biological aspects of things, but looking more into helping that person reconsolidate new memories and experiences associated with what's happening in their body.
Right.
And you have to really, in my opinion, you really have to work on that emotional aspect as well. Because you are working with a person in pain who is suffering, and the meaning that it's having in that person's life and their lived experience. So yeah.
Would you suggest that men go and see a PT who specializes in male pelvic health?
Yes.
Or can they see? Yes.
I would, yes, because not every therapist is as comfortable as I am working with male parts. Right. And that's one of the reasons why I created my course, treating male pelvic pain, because I want to share with how I interact with male bodies. And it's really nonchalant. I even had a patient do a video to share with all the students, talking about like letting me be vulnerable, treating my genitals just like as if it was another body part. Like, I don't want to feel ashamed of my body, because the energy that as a practitioner, people will feel that. If you're nervous, your hands, your body language, what you're doing with your eyebrows, like, right. All those things that we don't think about because we are like, we're not aware of our own stuff. I think working as a practitioner who can be more aware of like, what is it that how does our body feel? So it's the same thing that you're paralleling what you're working on with your patient. How does your body feel when certain situations arise? Like, yes, that person on the table might have an erection because you are stimulating nerves in that area that reflexively will stimulate that erection reflex. It doesn't mean that person is aroused or that there's any sexual connotation to that. It's just more of a social cultural thing, right?
Right.
Because it's like women can be wet down there, but not be aroused. Yes. So that's, there's a discordance between that. Doesn't mean that when my vagina is wet, that I'm ready to go and that I'm all aroused. No, because you can have that without having that other stuff. So it's the same for guys.
So your course, is that for PTs? They could take that course.
Any health professional who has a license to perform examinations, assessments, external and internal work on.
So we'd be looking
bodies.
at medical
MDs,
doctors,
DOs, RNs,
nurse
practitioners. And I even know in some states, this is just coming to light for me not too long ago, but massage therapists in North Carolina, it is in their practice act that they are able to perform internal work. I just think it depends on the state.
Right. And so then is there a directory where people can look for pelvic health professionals that specialize in male pelvic health in the US? I know we have one here in Canada. It's Pelvic Health Solutions.
Yes, I love it. I was just teaching for Nellie and her group there not so long ago. But yes, pelvicguru.com is run by Tracy Scher, and they have a huge directory. Actually, she just launched this. It's multidisciplinary too. So it's not just a PT, but if you're looking for any health provider in the pelvic health realm, she has a wonderful directory.
I'll make sure to link to it in the show notes. I joined it recently and it's a great one.
Yeah,
and it's
awesome.
Globally, correct?
Yes.
It's globally.
Yes, absolutely. So that's one that comes to the top of my head. You also have the APTA section on women's health, but again, it's not men's health friendly. Although they are changing the name to be all encompassing and not just the section on women's health, because we know pelvic health is not just women's health, but it's all bodies. And so they just recently changed the name, and I can't remember that, and it hasn't been like official. They just voted on it not too long ago. But anyway, you can check that website, the American Physical Therapy Association section on women's health. I'm trying to think of any other. And I know there are some lists. I have one on my website of a resource list. Let me see if I can send you the link, honestly, because it's on my website. But there's a list, a running list of providers, like on a Excel spreadsheet, that has their contact information and what they specialize in and stuff like that.
That's great.
I can share that.
And we'll also link to your website as well, because you have lots of resources on there and you have a podcast. Do you want to talk about your podcast for a moment?
Yeah, thank you. Thanks for the plug. Yeah, I have a podcast called In Your Pants, and it is everything pain, sexual function, and a lot of my topics are around men's sexual health, sexuality. But there are, again, I try to make things all inclusive. So yeah, that's my podcast.
That's great. Is there anything else? Is there anything that you wish that men stopped hearing, some kind of a myth or this kind of piece of information, and wish that they knew this about their pelvic health?
I have so many. This is very good. It's like, what do I say? I think the biggest is that, that you don't have to live with you don't have to live with pain, or it doesn't have to be part of you for the rest of your life. And that another myth is that, I think it's around sexuality and sexual function in general, but what guys might be, where they learn about their parts and how things work, I really wish that they would get a sex ed class that actually talked about, well, like if you have performance anxiety, it's okay. A lot of guys do, and it doesn't mean that that you're broken. So I think we need to be more body positive and sexually positive about the happenings in our underpants, and instead of pathologizing it. Like we don't have to have, like you mentioned earlier, a dysfunction. Like, why does it have to be a dysfunction? Let's stop putting like labels on things when they don't really need labels. Let's start to normalize sexual function for people and have them feel really comfortable to talk about it. So anything that just doesn't make you feel like you're performing optimally in your body based on your own experiences and not what you were told or should be doing or lasting, or this is how big my penis should be, that sort of thing. I feel like those are all just super, like, just negative myths about sexual health in general. So yeah, that was a really long answer to your question.
It's a good one, though. I'm waiting for you to revamp the curriculum that goes out to kids in high school for their sex ed. Wouldn't that be great?
I know. I know. Mine sucked. Mine totally sucked.
Yeah, I think even females and males all the same. Like, why weren't we told these things?
Exactly. I think there's a great book I got from my godson. It's called Sex is a Funny Word, but it's for teenagers. Yeah, Sex is a Funny Word. It's a book. I think all adults should read it. It's meant to be for teenagers, but it's an awesome book. It says a book about bodies, feelings, and you. And again, it's non-gender conforming. It talks about how our parts are different, how they work, and sometimes you might get an erection, but it doesn't mean that there's anything, it's just such a great book. So I bought it for my godson who's just turned 1. So hopefully this book is so relevant by the time he turns 13 or 12 when he can read, oh my gosh. But yeah, Sex is a Funny Word. I think that's a really good book.
Thank you so much. This has been so interesting, Susie. And if our listeners have questions, I'm going to have all of the links in the show notes so that they can reach out and talk with you further.
Yeah, thank you so much for having me on the show, Shannon. And thanks for all the listeners for listening.
Oh, connected yoga teachers, I'm popping in here. I had just finished the interview with Susie, and then we got talking a little bit more about hernias in men, and specifically hernias in exercise. And I wanted to include it in this episode. So here's what she had to say about that.
Well, that certainly can be a possibility of having a hernia, and the guy will know something is bulging out of his lower abdomen or something abnormal. At that point, you definitely want it to have a medical assessment, somebody that, if it needs surgical repair, but we don't want to be too quick as well, because you can have really small and minor weaknesses in the abdominal wall, especially through the spermatocord. That's why men will get them more, because when the testicles descend from where the kidneys live and utero, they kind of take all the tissue from the back and the fascia and then go down into the groin and nestle into the scrotum. But, that all is the same continuous tissue, but that exit point is where you have an opportunity for weakness. But it doesn't always have to be there. Hernias can happen anywhere along that route, or even in the femoral region, or the femoral triangle region in the upper thigh, but or into the testicle or the spermatocord. But at that point, again, that's surgical. You want to make sure that you're taking care of that and have medical guidance with that. But mild hernias, a lot are asymptomatic. You may have one and not even know you have one. It's not always problematic. So we know that some people have them and are asymptomatic. Some people don't have them and are sometimes they have them and they're asymptomatic. Sometimes they have them and they're symptomatic.
Right.
So I just don't think we need to be so quick to surgery, especially for minor hernias. And we can really help to lessen the exacerbation of a hernia if it's super mild by, avoiding constipation, not holding your breath upon exertion, right? And making sure that tissues are healthy, moving, have blood flow, movement, and space. Those are all really great.
It's reminding me of these are a lot of the same things that we do for diastasis and also for pelvic organ prolapse. It's like the pressure has to go somewhere, and the pressure has gone somewhere different for men.
Right, exactly. And of course, you have nerves, as I mentioned, going from the lower back and that run through several, your layers of your abdominal tissue and your abdominal wall, that they can get aggravated and cranky if there is something compressing on those nerves or branches or something like that. So if they're having sharp shooting, burning pain, that's nervy, when they're doing exercises that involve any abdominal, intra-abdominal pressure to increase. And it's mechanical and you can it happens all the time. Then I would definitely want to make sure that we're ruling out that potential trigger of having a nerve being cranky because of, tissue just entrapping around those areas. So.
Right. Okay. Thanks for expanding on that.
Yeah.
Thank you again, Dr. Susie. I learned so much on top of what we already learned in the Pelvic Health Professionals membership site. I'm super excited that you're talking about male pelvic health. It is something that isn't talked about enough. I also want to give a huge shout out of thanks to everyone who posted a question about male pelvic health in the Connected Yoga Teacher group. That is really where a lot of today's questions came from. I skimmed that list and clumped them together and organized them and asked Dr. Susie as many as I possibly could. I would like to hear from you, Connected Yoga Teachers. I'd love to know what your key takeaways were. What did you learn from this episode that you might bring into your yoga classes? Do you know anyone else in your area who specializes in either teaching men's yoga or in men's pelvic health? Any of your comments can go on our show notes page. It's theconnectedyogateacher.com/151. Or if you can't remember numbers, just go to the Connected Yoga Teacher page, go to our search bar and search male pelvic health, and you'll come up with this episode. If you're listening in real time, the Pelvic Health Professionals membership site closes very soon, Friday, January 17th of 2020. I'm not sure when this is going to reopen, but I do know that it's likely that the price will go up. Right now, it's $25 per month or $250 per year. And this is a very niche down specialized place for you to learn more about male and female and any other person pelvic health. This is where you can really help your yoga students to learn about their own pelvis, to learn about the muscles that are in there, to learn about the pelvic organs and how they can use yoga to help their pelvic health. If you would rather learn in person, and especially in the sunshine, I am teaching in Bermuda March 6th, 7th, and 8th. I am so excited about that. It's over 3 days in Bermuda, but it's still 20 hours. And if you are going to Bermuda, let me know. And let me know if you have some time before and after, because I am going to be there exploring. I absolutely love Bermuda. I've been there twice. I'm about to go again. I love the people. I love the area. I love being in the sunshine and swimming. So let's hang out there together. And if you can't make it to Bermuda, there's another training happening September 19th and 20th in Meaford, Ontario, thanks to Beth Ruddy and her beautiful space there. So maybe you'd rather come to Ontario and see the fall colors and enjoy some sunshine here, hopefully in September. To find out more about that, go to theconnectedyogateacher.com and look under trainings and events. I want to give a shout out of thanks to our team over here at the Connected Yoga Teacher, Suzanne, Crunch, Nick, and Sinead. Thank you so much for all that you do to make our podcast episodes possible. Thank you also, dear listener. It is because of you that yoga is being shared out in the world, and it means so much to me that you have taken the time today in your very busy schedule to have a listen all the way to the end of today's episode. So you know my sign-off question. I want to know, what will you be doing this week to stay connected to yourself, your yoga practice, and to your community so that you can share the yoga that lights you up?